Hey guys, Dr. Anderson, and I'm here from Anderson Podiatry's clinic, and I'm here with Santos, and she recently had surgery, recently diagnosed with diabetic neuropathy. Basically, she came in with a lot of symptoms in her feet and her legs that seemed like neuropathy. We got some labs done, and we figured out that she was diabetic. Nobody had ever discovered that, but it all started with her nerve pain from her diabetic neuropathy. And she actually, about a month ago, had surgery on one leg to open up nerve tunnels that are tight. And she's doing quite well. In fact, how much better are you? And we're going to use our interpreter here because Santos doesn't speak English.
Que sí, que tanto ha sentido mejoría. ¿Qué porcentaje?
Por el 90%.
90%.
About 90% improved.
Yes.
Okay, excellent. So one thing I'm going to mention to you, because if you watch this video, you may have heard, well, if you have neuropathy, especially diabetic neuropathy, there's nothing you can do. And you need to hear that there are doctors in this country that for 2 decades, you heard me right, 2 decades have been reversing diabetic neuropathy in patients, okay? All you're going to hear out there is about treatment with medications. Typically, it's really common. You're going to hear about gabapentin, you're going to hear about Lyrica. And if you're listening to this, I'm trying to tell you, you don't need to take those drugs. And in fact, you're putting yourself in a very dangerous position by taking them. In fact, they're going to help you get through the painful part of this, and then you end up at the other end of the trend, I guess you could say, of neuropathy, and you're going to have feet maybe that are just numb and very weak, and you're more subject to amputation, okay? We have 2 papers here, and we actually tried to present these to American Diabetic Association main meeting twice, and they refused twice. And you just hear that. Twice we've been kind of not allowed to speak about this. So when you go to those websites, you understand that this is very much controlled by Big Pharma. And that's what I want this video to be about, is understand that this is one study, there's other studies out there, but this is a very good study. The first one we have and the second one here, both of these are showing in the operating room. We actually did studies on patients as we did surgery, testing with EMG to see if their nerves were working better, and indeed they were. So this is study number 1, and this is study number 2. So, I mean, you can't argue with a machine in the operating room that's saying the nerves are working better. So I'm going to go through some data here, not all of this, but maybe highlight some of this. This is different age groups. These bars here represent the change in waveforms. This is kind of complicated, but when we are stimulating nerves in the operating room and signals are going down to the muscle, and then how much the muscle contracted is called an evoked potential. The bigger the wave, the bigger the impulse going to the muscle, the better the health of the nerve is. So you can see these darker bars, these are the results of the studies after, and these are the ones before, and these are all categories by decade. So in other words, people could have diabetic neuropathy for, maybe 5 or 6 decades, they still got improvement. This isn't something that the opportunity to get you better goes away in time. It might go down a little bit, but not much. This other one here, this is by diabetes, how long you've had diabetes. We had one gentleman, he'd had it for 60 years, but you can see these people have had had it for a lesser amount of time. But the point I want to make, the darker bars are showing increased nerve function. The lighter bars, a lower nerve function, but the darker bars are what the nerves are doing immediately after the nerve tunnels are open that were tight. And here's another one. This is very interesting. BMI, what's that? That's weight. The more weight you have, the before, which is the lighter bars, and the after, the darker bars, there's a bigger variance, a bigger difference in those that had more weight. They actually got better nerve function from this. So from doing these surgeries. The point also, one more thing before we let you go, a lot of technical stuff, but when you have diabetes, you're breaking your sugars down differently, and you create a sugar molecule called sorbitol. It gets in your nerve and it attracts water to the nerve, and so your nerves are actually about 40% larger. Studies have been showing that for many years, and that is why, mechanically speaking, once you have these big fatter nerves, that nerve's going to be squeezed in a tunnel. A good example would be carpal tunnel in the upper extremity. We've known for years that much more likelihood of having carpal tunnel in the diabetic population than non-diabetic, and that's the reason why. But those same rules do not apply in the lower extremity. Again, you're told nothing you can do. You're told there's only medication, and that's the dogma. That's the problem, because more people knew about this, there will be a lot less people having to worry about amputations, and at the end of the day, and just being able to sleep better and not have to worry about all the pain and going through. So, and also, Santos had a lot of hard time walking too, right? She had some weakness. So anyway, a lot of information. Please consider that. If you're diabetic, understand that there are doctors that are trained in peripheral nerve surgery like I am, and that can help you reverse your neuropathy that's caused from your diabetes. Please subscribe, and thank you for watching.